So this app, I would say we built this maybe 2 or 3 years ago because one of my faculty members said, "Hey, Mike, this is a summer class. The students hate reading about gait patterns. They hate reading about how to set up an assistive device. If they could just watch it once, they could know how to do it. It's so efficient, so quick." And this class includes transfer training, bed mobility, wheelchairs. This is our kind of clinical skills 3, I believe. It's one of our fundamental classes. And so I said, hey, that's a great idea. Why don't we sit down, map out all the things that you would need to typically show in class and things that they would have to read through, and let's see if we can just film it all. So just real quick, I just wanted to show you that we are very focused on making sure we meet the curricular standards. So you can see that we fit this non-system equipment, devices, and technologies part of the test content for FSBPT or the MPTE. And then from the CAPTE perspective as well, that it kind of fits these different standards. So again, the hope is that these resources will one day make your accreditation and reaccreditation so much easier because these apps are all mapped to meet those needs. So I just wanted to put that out there. All right, so here are a couple of questions that we were trying to answer when we built this app. How can I train students about different assistive devices? What's the easiest way? Could I prep them before they even came to class so that when we were in lab together, it was efficient? They could just pull out their devices. We could talk briefly about it, and boom, they were using their assistive devices and interacting with the devices as well as each other. The other thing we were trying to answer was is reading the most efficient way to teach gait patterns? And then what about transfers and bed mobility? Sorry about that. So let me take you to the app real quick and show you what we've done. So I'm going to come over here. When you log in to the PhysioU web app, you'll see that we have now organized all of the apps on one side and all of the microlearning, simulations, microlearning, all of that is now on the right-hand side. The other thing you can do is you can always look for different big categories of apps. For example, here's the fundamental skills group, and it sorts a lot of the apps for you. So you don't have to dig through and find everything. So here in the fundamental skills, you see assistive devices. In the Assistive Devices app, here you have sections, all the various sections of skills that we would have to teach. And here you see assistive device fitting. There's a short video talking about preparation for fitment. So let me just show you that real quick. So here's gait belt application.
Mike, check your share screen thing. Some folks, yeah, we got about 3 people now who are not seeing everything.
Oh, let me try to reshare screen.
Thank you, folks, for letting me know that.
Does that work, James? Can you see my screen?
I've seen it all the way from the beginning. The screen,
okay.
I don't know what
there we go.
So.
Okay, perfect.
Good. Thank you, Andrea.
Sorry. So if you look through back to the beginning of the app, you can see that here we have all of these key categories, and I'll show you a glimpse of each thing in each category. So here you have preparation for fitment and the use of the gait belt. You can also see, for example, we want to set someone up with a walker. How are we going to do that? And here are all the different walkers. So here's a front wheel walker.
This assistive device is a front wheel walker. To adjust the front wheel walker to fit your patient, you will first unfold the walker until you hear a click, like so. You will then place the walker in front of your patient. You will have one hand on the walker and one hand on the wheelchair and have your patient stand up like so. You will then adjust the handle to the level of the patient's wrist crease. As you can see here, the patient's wrist crease is above the level of the handle, so I will need to adjust the handle. In order to do so, I will first have the patient sit back down for safety. I will then take the walker and turn it upside down. I will then press in the silver button and adjust each leg accordingly. In order to confirm the fit of the front wheel walker, you will have your patient stand up again. With the patient holding onto the handles, you will bring the walker 4 to 6 inches forward. You will then look for 20 to 25 degrees of elbow flexion as seen here.
So from what you can see here, our students are watching these ahead of time before they even come into lab. And what I mean by that is we have, if you go here into PhysioU.health under Educator and under Faculty Resources, you will see that there is some teaching content available. And in this teaching content, I'm going to make that a little bit bigger. You can see lab handouts. And here is the Assisted Devices Gait Training Lab handout. So you can see that we have created assisted device fitting worksheet. Here is an assisted device fitting handout. So here, these are things that you can download and modify and use to your however you want to use them. We built them. We figured we'd just share it so that everybody could use them. So you can see all of those videos from that section of the app is laid out in a little handout. And all of these are hyperlinked. So the student, as they're preparing for class, they're going through this lab handout and they just click on the videos and watch before they come to class. So think about what that means from a graded exposure. I think of motor learning through the perspective of graded exposure. Multiple exposures over time allow for new things, allow for the students to really grasp what is going on, to hear what, to prepare as they come to class, so that when they actually hear us talking about these things, it's not the first exposure. And of course, all of these techniques, all of these instructions, they can refer back to later when they get out into the clinic or into the hospital. So you can see that we've created not only, let me go back to assisted device fitting worksheet. Here is a worksheet that we use in our class. And we ask the students to fill these different things in: proper measurement angles, affected lower extremity for the appropriate assisted device placement, weight bearing status. So there's all of these little worksheets that you guys can feel free to utilize. The other way, let me just see here. Let me go back to our app. The other thing I would say that we've created is the students are able to share these videos with their patients. So I'll show you that when we come to the gait patterns. So let's take a look at gait patterns real quick. Here are the different gait patterns. A short video about the use of the gait belt and the therapist's position. These are all things that the students watch ahead of time. And let's take a look at a modified three-point gait. In the modified three-point gait, what you'll see is that there is a quick video related to indications.
For a patient that has one leg affected and the other leg is full weight bearing, modified three-point gait can be used using either a walker or crutches. For a patient that has no weight-bearing restrictions, bilateral canes can be used.
So here you have some basic instructions, some notes, and if we go into using a modified three-point gait, let's say using axillary crutches, we have filmed videos for both right and left lower extremity. So here's the right lower extremity video.
For modified three-point gait, with the right leg affected, have the patient first bring the crutches forward, then the right leg, and finally step through with the left leg. Continue with this pattern: crutches, right leg, left leg. Crutches, right leg, left leg.
The students told us that it is so much easier to understand their notes and what they're reading when they could just see a video of how this is done.
Michael, this is James.
Yes.
A couple real quick things here. I think number one, a great word you use is graded exposure. I think that's great for the students. It's how to eat a whale one bite at a time. And by doing it the way you're showing how you do it, it's really easy for those folks to finally kind of ramp up to the high level. The other thing is a question for you and also the other educators is that um, the stuff that they can watch in advance in like pre-lab stuff that is not analysis and that higher level, thinking, it's just the facts. Like what's 1 point, what's 1 point,
Well,
what's
it's
2 point, what's 3 point, and
low
that stuff.
on blooms. It's low on blooms.
Yeah, low and blues. And so, and maybe that can save time. When I was teaching, it was always crushed for time. We didn't have enough time in lab. And
That's
if
right.
there's something they could do, and the only thing I kind of put a gun in their head was to say, that's a bad analogy. I apologize. To get students to do it is a quiz, a pre-lab quiz. And so now, though, they have this video to help them learn it.
Yeah.
So
I
yeah.
think the pre-exposure allows for so much better interaction with you as a faculty member, as you as the specialist, because you now have some scaffolding to build upon. You can nuance, you can talk with them about the videos and point out some nuanced things that you want them to take note of. They're much more ready to receive that because the fundamental knowledge is already kind of in place.
Yeah, and a picture's worth 1,000 words type kind of
That's
mindset.
right.
They see it.
So we teach the students how to do these and they go and practice on their own. But we also tell the students, hey, by the way, there's no better way for patients to learn than modeling. So when you are teaching your patients how to use their crutches, you can show them this video first. Then when you are done showing them and practicing with them, you can open the sidebar and you can share this page to the patient. So you can basically email this page. I can say james@physiou.com. There's James. Let's see, James. Yep, @PhysioU. And I can just send that email straight to James. So the patients don't have to have a subscription. This link is available for it's available for a week until 12/10. So the patients now this extends the ability of the student, of the clinician to, educate the patient, to provide follow-up education, to share this with the caregiver. So I think those kind of things are really valuable. It's why we went through the double work of filming right leg, left leg. All of the videos we filmed have that ability to share with patients. Let me just stop for a second and ask, are there any thoughts or comments related to this type of feature?
Hello, Michael. This is Sam Capoletti.
Oh, hi, Sam. Great to
How are
see
you doing?
Good.
Hey, could you go back to that teacher resources screen? I want to get a screen capture of that to show my other instructor.
This one here?
The one that had all the, you were in it about 5 minutes ago. It had all the
yeah.
worksheet right there.
Educator faculty resources.
Yep. Okay, good. Let me get a screenshot of that. I'm going to show them where that is. If you click on that.
If you click on that, then you go to teaching content.
Yeah, that's it. That's the spot I missed.
Content, there's the lab handouts.
Great, thank you.
Yeah, absolutely. Any other thoughts, comments?
I'll say Misty Miller's on here also, and she and I teach together at Texas Tech Health Science Center. And we did kind of a version of this with this information over the fall. And instead of using your handouts and whatnot, we kind of created a quiz in our LMS that got them engaged in that content and was a little easier to grade or look at. And it worked out really well. The students enjoyed it. They were able to go back and look at the videos as they needed to. Like you said, that pre-exposure piece, all three of our lab instructors felt really helped us in lab kind of move forward a little bit quicker. So we loved it.
That's great. That's great.
Can you comment on that? There's two of you guys using it there. Is that kind of help potentiate? Like it's not twice as good. It's like 4 times as good because the students see the continuity maybe in it or something. Is there any comment?
So what, two of us, like the two faculty, you mean? Or
yeah.
So we're a multi-campus system. And so we're one program spread across 3 campuses. So I'm based here in Lubbock, Misty is in Amarillo, and we have another lab instructor in Odessa. So our the classroom piece is done synchronously over TechLink, which is kind of like an internal Zoom, but our labs are run on the individual campuses. So while I was teaching it here in Lubbock, Misty was teaching the same content to her students up in Amarillo, and we don't connect via Zoom or anything for that lab piece. So sorry, go ahead.
Well, then does the PhysioU app kind of show can maybe facilitate some sort of consistency between the various locations?
Yes. Oh, I see what you're saying. Yes,
Yeah.
absolutely. Yeah.
And it helps you with CAPTI too, because they go, your left hand doesn't know what the right hand's doing because you're saying you do this and the other camp is saying that. So
Yeah.
it
And
is a
Misty
big
and I
deal.
have taught together long enough that we know we're kind of doing the same thing, but there's always going to be that individual spin and the, students hear different messages. So to have that same pre-work that they all did ahead of time, and, then bring that into lab, that was definitely helpful. Sorry, I misunderstood your original question.
Oh, no. And then when you guys start answering each other's questions before you ask it, you're, oh, we've been teaching too long together.
I will say too that our students, we just had lab practicals too last week. And so I did hear some students commenting, I went back and looked at the videos again as I was preparing and practicing. And, sometimes they're practicing when we're not available to ask questions. And so they're in the lab and they're pulling stuff up and looking at it and reviewing it during preparations as well when the faculty is not available.
Yeah, absolutely. I mean, some of these apps, if you think about ortho and how massive ortho is and how many different ways people like to do special tests and manual therapy skills, the variation in the practice is so wild, even within our 5 faculty, that it really helps when I can say, guys, we're going to show the technique the way the app does it, and we're just going to all agree to be the same, because that reduces the anxiety of the students. It reduces the ambiguity. So I think this, it really fits also for these multi-campus. We presented this year at ELC with several colleagues from Penn State. They have, I believe, 5 different PTA programs, 5 different campuses. How nice is that everyone's teaching the same assisted device, transfers, bed mobility, all the instructions are the same. So I think there's great value in that.
Yeah, the unwarranted variation is the Achilles heel for us sometimes, especially when I'm out there in the political arena legislatively. How come some PTs do this, some do that? It's like, I don't know why.
Yep. So that was gait patterns. I just want to show you that we also filmed what is often not that easy to show, because you only have one set of stairs inside your building and we've got 72 students crowding around. Well, they just watch it ahead of time. So videos about preparation for stair training. You can choose, let's say, axillary crutches, right extremity, make that a little bit bigger, affected or non-weight bearing. So let's go affected. Here is the right lower extremity affected, and the students can watch. Again, the red stocking is on the right limb. The students learn watching these videos, and then they teach their patients by watching these videos together, and then they share that with their patients. So, I mean, I think that kind of learning and transition into clinical practice and utilizing these tools to enhance patient care, I think it's a big deal. And it's always in their pocket, right? So here are our videos. Let's just take a quick look here.
As your patient goes up the stairs with crutches and the right leg is affected, have your patient first step up with the left leg. Next, the right leg. And finally, the crutches. Continue with this pattern. Left leg, right leg, crutches. Left leg, right leg, crutches.
The nice thing too, I think, is you don't have to dig around as faculty anymore on YouTube, hoping that last year's video is still there. This is always here. And it's always, anytime we get feedback from faculty, we can go back in and film. We haven't had to do much for this app. Grace, who was in charge of doing this app, very particular. So I think in general, you will see a very standard, basic style of transfers, bed mobilities. I think everybody will do it slightly different, but the basic way is there. And I think you as a specialist, as an instructor, can add the nuances however you so choose, but at least the basic foundation is there. So you've got stairs for all these different devices. We'll move on to bed mobility. So again, an instructional preparation for bed mobility. And then you've got these different videos like supine to sit.
To assist your patient from the supine to sitting position, you will first begin by asking your patient to bend both knees up, one at a time. You will then ask your patient to reach towards you, and you will assist them at their shoulder and their hip as you roll them towards you. 1, 2, 3. Next, you will ask your patient to assist you by pushing through their elbow and their hand as you assist them at their shoulder and their legs and sit them up in one fluid motion. 1, 2, and 3.
Okay. So you've got bed mobility. You've got sit to stand and stand to sit with various different assistive devices. You've got transfer training. I think we should take a quick look at transfer training. So let's do a partial stand pivot. These are the different options.
If you are unable to guard both legs at the same time, you can guard the leg that is closest to the chair. On the count of 3, we're going to transfer you to the chair. 1, 2, and 3.
So from what I've, in talking with some of the instructors, they say, hey, lots of times we'll bring these videos up. We'll talk with the students about it because everybody sees the same good view. And then we add some of the nuances that we want to add on top of the basic video. So all of your basic transfers are here, again, with all kinds of variations so that students can watch them, learn them, and then again, share these videos with the caregiver at home. Let me move into wheelchairs. We also teach basic wheelchair fitting, wheelchair propulsion. So here is, for example, fitting, a short group of video vignettes related to setting the armrest height, wheelchair back height, the seat depth. So we can just take a look at that.
In order to assess for correct seat depth, you will place 2 to 3 fingers in between the seat and the popliteal fossa. If it is too short, there will not be enough stability or support, and there will be increased pressure on ischial tuberosities. If it is too deep, there will be increased pressure on popliteal area, and this will disrupt circulation.
So you have all of these short videos that students can watch ahead of time: seat height, seat width, armrest height. If we take a look at the components, we talk about all the different parts of the device. I just remember talking with Grace, and it's challenging to try to teach to a group of 70 to show them all these different parts. You don't have to do it anymore. They watch the videos, they've learned it. That's it. You move on. And then here under mobility or propulsion, you can see we filmed 1 lower extremity, 2 lower extremity, 2 upper extremities. So these different videos that can be, again, shared with patients. And then we also have going up and down curbs, going up and down ramps, going through the doorway.
Mike, you want to add that there's also still like mini quizzes with all these, right? There's questions and stuff during the videos.
That will be coming up in the next section. I'm just going to show everybody what we've been building.
Got it.
Yeah.
Thanks.
So you have all of these videos for students to learn, for patients to use as well. We also built, because we always felt like it would be useful in class to have short case studies to help take this knowledge and put it into a clinical setting. So we have these simple little case studies: 35-year-old female with a right distal tibia and fibula fracture. Here's the case. Of course, this is a year 1 class typically, so we know that they don't know a lot yet. So we've written the case very simply. Here are the basic questions we ask them. So we'll just say, hey guys, we're going to do this first case, 35-year-old female. You guys get together in little groups, talk about the case. Soon these down arrows will be hidden and only available to faculty. So when you go and prepare for the discussion, when all the groups come back together, you can now open up on the screen the answers and discuss, but you're already prepped. So you can just take a look at the question, take a look at the answers, and then you're prepped to discuss this with the patients, with the students. So how would you adjust the assistive device? For gait training, what gait pattern would you use? So there's a number of different simple little case studies here that you can utilize that will help kind of take this basic knowledge into a more clinical reasoning, basic clinical reasoning context. The last thing I want to show you, any comments about this or questions about this?
There's a question I'm going to have you answer, Mike, later before we run out
Okay.
of time.
Okay, great.
Well, just to affirm, Mike, I actually used the wheelchair mobility videos yesterday in our lab.
Awesome.
I have a really shortened lab time, and just navigating doors. We have 24 students in a pretty small lab space, and not enough wheelchairs for everybody. So we looked at going in and out of doors and propelling, and I said, okay, go try it. Had them in different groups. Some groups were working on going in and out of doors. So yeah, just being everybody to see the same thing at the same time, and then just go play with it rather than having to go through the explanation.
Fantastic. And I hope Andrea, is it Andrea or Andrea?
Andrea.
Andrea, I hope you also felt this subtle relief, because I always do. When I can say, guys, take your app. We're going to do propulsion, going up and down curbs. You guys take your apps and go practice. Then the pressure is off of me just for a little bit, and I can go and help and follow up with students. That little bit of pressure relief is an absolute lifesaver.
I agree.
Yeah.
Yeah, and just the consistency that they've all seen the same view. And yeah, you have to go back and say, well, in this situation, you would also have to do this to get through the door and that type of thing. But yeah, it's very helpful.
That's great. So the last thing that I want to show you was we have been building tons of microlearning and mini sims because we think students need opportunities to play with their knowledge in low risk, low stakes environments. So Assistive Devices will now have a companion of microlearning and mini sims. We are vetting them right now. We spent the last 2 months, I mean, actually from ELC, I don't remember whether it might have been you, Kate, or Misty, who said, hey, we would love to have more case studies and more ways, because I know you guys are building some of those. We're building them for you so that it can be easily scored. So what I mean by that is we have now built games, knowledge checks. They're really knowledge checks. And we're also building a bunch of cases, short cases for weight-bearing status, device fitting, gait patterns, bed mobility, transfers, guarding, wheelchair fitting and components, wheelchair propulsion and mobility. All of these have games now. We're just double checking them right now. So this is just for example, how I envision you guys using this, how we're going to use it is at the end of that week, when they have learned that material, their job is to go play their knowledge checks and to submit. So here is, for example, please match the correct level of weight-bearing status to its description. So it's just drop-down menus. Here's another example of identify the gait pattern. So they watch the video from PhysioU, they identify the gait pattern, and they get a point. Great, it's simple. It's like cheap dopamine, but you're helping the students prepare for their exams and quizzes, and you're giving them something to do instead of, I think what happens is they make it through the end of the week, they drop everything out of their brain. I think there's a moment that we need to capture where we have freshly inputted lots of great knowledge. We need to let them play with that knowledge and just kind of let it out in context. So here is, yes.
I'm Mike Wong, and so questions.
Yeah. So here, let me just show you a few more examples. I opened a few here for us. So here you have bed mobility. And they can basically, you can see James is going through all of these and giving feedback. Grace, the other professor who teaches this class. And the students will play through all of these different games. Bed mobility is a critical component of functional mobility. Which statement helps to describe bed mobility? So it could be just, you know, all of these very simple, a lot of these games are low-level Bloom's taxonomy. My intention is that what they have studied and what they have learned from our lectures, they can now draw it out of their brain. So that's the goal for all of these little games. So let me just keep moving here. Let me show you a gait pattern game. Oh, here's transfers. So with transfers, review transfers, review levels of physical assistance, review appropriate body mechanics. These will be multiple choice questions. Please match the correct physical assistance level. Independent, patient does not require any assistance. You know, so they basically go through and play all of these out. And here is gait. Let me see. Here's guarding. Let me go back to gait patterns here. Let me see if I can find that. Yep. So here's the gait pattern. So the students watch the gait pattern, determine what level of gait pattern that is. So again, what I would say is that soon, where these will be is if you go back to the PhysioU main website, the main web app page, you'll see that all the purple components are all microlearning. So those mini games that you just saw are going to show up here as a purple set of crutches. And you will be able to essentially assign the students to do, I need you to do the guarding game. I need you to do the assistive devices fitting game. I need you to do the wheelchair game. And when they're done with those games, you will be able to, let me just show you what I mean. If I go to shoulder, this is a range of motion MMT game. There is a record of them taking all of it, how many times they played their game, what score they got, how much time they spent, and they can download that and basically submit that to you.
So Mike, this is a good segue to the question I would need to ask you that was in the chat, and that's LMS. Where are we, and Daniel asked, what's the integration to LMS? And I know this kind of does some of that. So
well,
comment on the direction of that.
I would say that it's on our list of things to do eventually, but integrating into various different LMSs is not that simple. And so where we are putting our resources right now is building lots of interactive learning. Sometime, hopefully in 2022, we will have the tech team free enough to be able to even consider what does it mean for PhysioU to be linked into the LMS in some way, and whether these scores can actually be pumped into a grade book or not. For now, the simplest and cleanest way for us to do this is for you to say, guys, you need to go and do your assistive devices gait training game. You can do it as many times as you like. We will take your highest score, and I'll give you points when you submit your learning report. And we just leave it clean and simple like that. Otherwise, we have not even been able to begin to delve into how to make these mini games link into your system and into your grade book. It's super complicated, and yeah, honestly, we just don't have the manpower to do it. We're spending all of our manpower building these types of learning tools and new apps.
I think when you eventually get to it too, Mike, I mean, you got Canvas, Moodle, Blackboard. I mean,
yeah,
it's like the water pump for a Ford doesn't fit a Chevy, doesn't fit a Toyota. You're gonna have to reinvent that wheel how many times? So
right.
Not
so
best use.
It's on our list. It's on our list, Daniel.
We're able to use the link page that you give us, and we just directly put the link in our LMS.
Right.
So
that is the easiest way, where you can just take, that's the other thing I would say is, for example, if you're like, I'm in assistive devices and here is a technique that I want to put into my app, into my LMS, you can just copy page title with link. So by doing that, it's now copied. So if you go, for example, to, let me just create a new doc. So when I paste that, you can now paste this and it is already hyperlinked. So you can paste that into your PowerPoint, into your lab handouts. And here you also have the option of copying, let's see, the thumbnail image. So the thumbnail image is essentially this image here. So if you put that again into your document and you're like, boom, this is how I'm going to augment my lab handouts and my lectures. I have a clickable link, a picture from PhysioU, and when the students click on that link, it takes them directly to their resource. So this is another cool thing that we've recently released. It's in the sidebar for faculty. And For students, they have the share page option. For faculty, you have all of these options to copy the page title, to take the image, and to augment your content. So I'm open to taking comments or questions. I just want to let you know that our next session next week, I'll be covering our acute care sims and games, the Lines and Tubes app, and the cardiopulmonary rehab app. And we actually are done filming for an acute care app that I will show you glimpses about, but we're not quite ready to release it yet. Any comments? And James, if you could remind, like, I'm happy at any point to jump on a Zoom call with any of you. James, if you just type in mike@physiou.com in the chat, please feel free to reach out to me. I'm happy to jump on a call to hear what kind of courses you're teaching and to help share what kind of things we have in the different apps that really might make your life a lot easier and make the students learning better. So yeah, any comments, thoughts, ideas?
I really like the addition. You and I we talked at ELC, and
Yep.
so I really like the addition of just the low level quizzing and the games and just being able to reinforce, even if they'll go through and review that after we've done lab or even the next day or two, just to be able to reinforce that and have another touch point of information so they're not having to do so much when they're going back to study for an exam.
Yeah, exactly. I mean, my vision for this is that at the end of each content curricular, like that week of content delivery, that they will have something useful to play with, something short and sweet, where they can say, yes, I know this material and now I can play it again as much as I want to learn that material. I always wished I had this. And then my hope also is that all of this will become part of their board prep tools. When they're finally done, with the program, they're going through and playing through all of these games related to neuro, acute care, physical agents, ortho, range of motion MMT. You should see the wound care stuff that we are fine tuning right now. It's amazing. It's really amazing. And so all of this is my vision for how to facilitate learning. It is not just about content delivery, obviously. I really believe that students need a space to pull that content out of their brain. And not everything has to be like pass, fail, pass, fail. It's just like, I want to play. I'm going to give them things to play with. And that's kind of what we've been doing.
A comment here, it's kind of a fun thing that I'm an old time educator where, it's like read the chapter, get ready for class, sit down, take copious amounts of notes, and hopefully you remember enough to pass your board exam and be successful in the clinic. And that's changed now. If I can count the time the word play was said today by you, Andrea, you tell us to go play. And I think it's so much more endearing for the students and much more friendly for them to learn. They want to learn. I think that the study of the impact, these knowledge that Kimberly, that you wrote, I think the clinical side, not just board passing rates, I think that the effect of this would be in terms of how successful and how boots on the ground these students will be ready to go when they get into the clinic because they've seen kind of the example and they can model it. So I think it's just a great way. And, I used to be critical of students. I go, I think they want to be entertained as much as educated. Well, so what? If entertaining them, it makes them learn more, good for us. Yeah. So it's kind of fun to see this occur. So I just wonder what the clinical side, not just board exam passing rate, the effect that this tool and this type of modality of learning can have on those students.
Yeah, absolutely. And Kimberly, you can easily take, for example, any of these mini games. Let me just make sure I know what I'm talking about here. So for example, physical agents, just because we don't have the other mini games available yet. If I wanted to take this, copy this page title with link, and throw this into my syllabus so that in week 2, after they've learned about cervical traction, they know that they've got to play that game. When they click on that link, they're going to go directly to that game and they can play it. And when they're done with it, they can just drop their learning report into your mailbox and they can get their points. It's asynchronous. We don't even have to lift a finger and they're going to learn. That's how beautiful. I mean, I can't tell you how excited I am with some of the ortho ones, because ortho is such a massive beast that the train just keeps going. Every week they learn another 50 techniques. And it is so imperative, I think, that at the end of every week, I build games for them that they can now play to use some of the patient, to look at the patient context. So here you see upper quarter and lower quarter. We're going to build guideline-based games. Every single clinical practice guideline, we are building a mini game, a formative mini game for that they will then be exposed to guideline-based content in a formative, fun way. It is going, I believe it will change the game for the orthopedic classes. But yes, I just wanted to show you that you could take any one of these, copy the page, and put it right into your syllabus, and it's seamless. They just know they got to do it.
Mike, you're back in the trenches at 1 o'clock Pacific time here, but comment from Giselle is, how do you get points for assessment with microlearning? Can you share how you do that?
Yeah. So for example, let's just say you gave, let me go back to my microlearning handout. We basically tell them, do it as many times as you like. We will take your highest score. So I purposely made the summary to give you the highest score and the 5 most recent attempts. So the students know that for each of those microlearning, there's going to be 5 course points, let's say, or 2 course points, however much you want to give. They can earn those just by playing these games. So when they turn these in, my grad student assistant, they will look at this and they will assign 2 points for every game that I've asked them to play. And all of that will just add up. If they end up saying, hey, 80% is good enough for me, then fine, they get 80% of that 2 course points. I don't know if that helps. Any other comments or thoughts? And this is a point where James and I, we just open it up. Happy to hear your thoughts, things that you feel like you need, questions that you might have. Thanks, Misty. Any other thoughts or comments? Thank you, Sue. Thank you. Yeah, we will have lots more mini games and interactive things because it's something that none of us really have time for, but I think it benefits the students so much.
Just a quick question. Do you have anything I don't think I've seen on infection control, PPE?
Yep.
That type of thing?
We filmed it all. We filmed donning and doffing of PPE. We filmed hand washing. In the app that's coming, there will be these different levels of infection control. Like we're making kind of infographics, because I don't think you need a video for it necessarily, but we've filmed donning and doffing of all the PPE. We filmed donning and doffing of all the braces for acute care. We filmed a bunch of scenarios, some horrible and some well done, so that students will actually be able to pick through and say, that's what I see that they're doing wrong with that total hip patient. So there's a lot of that type of interactive learning that's coming. That app is kind of massive because we also created basic protocol for all the common surgical conditions that the students are going to see in the acute care setting. So we basically tried to aggregate all of these common protocols. What are the common things you're going to be looking out for, common precautions and contraindications, common goals for your day 1, 2 type management. All of that is being compiled into this acute care app. So there will be basic vitals, bracing, donning and doffing, and purpose of all the different types of bracing. There's kind of animations of negative pressure, positive pressure rooms, anteroom, a lot of the basic stuff that we want to deliver. And then there will be a lot of case studies that we filmed as well. So that's coming. It's a work in progress. Other comments? Thanks, Kimberly.
I'm curious, if there's any programs out there, or if you are actively doing assessment on the impact on student learning. I mean, I know anecdotally, I don't remember which semester, but I did some surveys of my students and how do they like it, how did they use it, comparing, textbook use and recommendation of continuing that. We actually eliminated one of our textbooks because of the PhysioU. But I don't know if you're getting data or evidence to support this, and evidence that students are learning more effectively, more efficiently, or more deeply.
We've
Yeah,
attempted. We've attempted to. I've got a lot of hats on right now.
Yeah, I bet.
Actually, it's to measure that well is not easy, I think. If like we've done surveys where students have told us about how efficient that how much less anxiety they have in lab when they don't have to hold a camera and hope that they can write their notes and capture the video at the same time.
Right.
So we have survey data that supports that, and we presented that at ELC. I would love to reach out to you to chat about what you've done and what you've seen in your survey. I think all of that information helps us. Honestly, I don't know how to do that research. It's something that I think it would be great if this is something that people, or it's on my mind. A lot of this I'm running by gut instinct, like these bare bone, like even just having videos nicely built, we know enhances the classroom. It's hard to objectify how much it helps.
Yeah, I know. I think what you're doing is great, and you can only do so much. I think it's on us as an educator. So every semester I do a little bit of assessment, right?
Yep.
So next semester I'm going to take a unit and I'm going to implement some of these things that you've shared, and then compare the last few years, especially in COVID.
Yes.
And the impact on student success on exams, on lab practicals. And I'll have a little bit of data, but maybe some of this,
that would be wonderful
to share that information with you, so
absolutely.
that you can tweak as needed. So,
yeah.
Anyway,
and
thank you for all your work.
Yeah, absolutely. And this type of classroom assessment does not require IRB approval. This is us checking whether our stuff works in the classroom. And that's the beauty of it. And it's okay for us to share it anecdotally. I think all of us know that we'll take all of that type of data with a grain of salt, but I really value that you're trying to make that assessment. We're trying to do it as well. So yeah, absolutely.
There's and Giselle wants to reach out to you, Kimberly, about working together maybe on some sort of assessment thing. See you guys at we'll see you at ELC with your data next year.
That's right. That's right. I mean, I think the pandemic gave us an opportunity to rethink how we do teaching and learning. And with these different types of resources now that we are creating, I mean, I pushed the team into triple overdrive over the pandemic because we knew that the students will suffer the most. I mean, faculty for sure are suffering, but the students will suffer the most. And I think it would be great to be able to collaborate, Kimberly and Giselle, to collaborate and to share kind of different things that you guys are doing that we can also support. We love that. In fact, it's even better that external groups are taking a look at this, I think. So it was wonderful. Thank you, Kimberly.